The lower eyelid or lower lid blepharoplasty is a very commonly performed procedure in our practice. The standard lower eyelid procedure that most patients are familiar with involves merely removing a little bit of skin and some of the fat in the compartments of the lower eyelid to make the lower eyelids less puffy. But in 2010, the modalities that we have at our disposal are actually much more sophisticated than this and go beyond this basic lower lid blepharoplasty. In young patients who don't have a redundancy of lower eyelid skin but merely some puffiness that bothers them from excess fat, we can actually make the incision on the inside of the lower eyelid. This is called a transconjunctival blepharoplasty, and remove the fat from inside the eyelid. This does leave a scar, but it's on the inside of the lower eyelid. So unless you evert the lower eyelid, the scar is effectively invisible. For more complicated problems where there's a marked delineation between the lower eyelid and the cheek, or the lid-cheek junction, we can use a variety of techniques to soften the transition from the lower eyelid to the cheek. We can actually use the fat in the lower eyelid. Instead of removing it, we can redrape it and fix it in place so that it provides a soft camouflage transition and evens up the levels of the soft tissue between the cheek and the lower eyelid to provide a smooth and aesthetically pleasing transition. Sometimes we augment this with fat transfer, taking fat from other parts of the face or other parts of the body to enhance the contour of the lid-cheek junction. Frequently, patients' lower eyelid aesthetics are dramatically improved by doing what's called a lateral canthopexy, which is a tightening of the lower eyelid as you would pull on a clothesline, and by introducing more tension, lift the clothesline up. This not only makes the lower eyelid look tighter and firmer, but can prevent the droop of the lower eyelids that's sometimes seen as a complication of lower eyelid surgery. The endoscopic mid-face lift that we perform is also frequently a beautiful complement to lower eyelid surgery, and by elevating the soft tissues of the mid-face, it can also dramatically improve the transition from the lower eyelid to the cheek. And doing this endoscopic mid-face lift in tandem with a fat-sparing lower eyelid blepharoplasty and using fat transfer as an adjunctive technique can really achieve some very dramatic results in rejuvenating the periorbital area of our patients and yields us some of our happy and most satisfied patients in our practice.